Good morning everyone. We would like to discuss about the skeletal system, bones and joint. What is skeletal system? The skeletal system consists bones, cartilage, ligaments, tendons, providing structural support, protection to vital organs, facilitating movement, producing blood cells, and storing mineral like calcium and phosphorus. The term skeleton is derived from a Greek word meaning dry, but the skeleton is far from being dry and non-living. It forms the framework that supports the body and enable us to stand, move, and perform various activities. I will discuss about function of the skeletal system. There are five major functions of the skeletal system and their brief meaning. First, support. The backbone is the main support center of the upper body. It holds your head up and protects your spinal cord. Second, protection. The bones of your skull protect your brain, your ribs protect your lungs and heart from injury. Movement. Skeletal system provides points of attachment for muscle. Your legs and arm move when the muscle pull on the bones. Fourth, the storage. Bones store minerals such as calcium and phosphorus for use the body. 5. Blood cell production. Red and white blood cells are formed by tissue called marrow, which is in the center of the bone.
Extracellular matrix describe the components of the cytocellular matrix and explain the function of each. Number 1. The structural protein. This includes the fibrous protein such as collagen, elastin, and fibronectin, which provide the structural supports and tensile strength to the CM. Collagen is the most abundant protein in the CM and forms a strong network and gives tissues their tensile strength. Elastin provide the elasticity, allows the tissue straighten the recoil, while fibronectin plays the role of cells and adhesion and signaling. Proteoglycans. These are the complex molecule composed of the core proteins with the long chain repeating units called GAGs attached. Proteoglycans helps to maintain the hydrated gel-like consistency of the ECM, and they also regulate the movement of the molecules through ECM. Example of proteoglycans includes dichorane, aggregans, and syndicans. Glycoproteins, these are the proteins that have covalently attached of carbohydrates, and they play roles in cells adhesion, migration, and signaling. Long bone are longer than they are wide. Short bone are approximately as wide as they are long. Flat bone have the relative thin and flattened shape. Triangular bone includes the vertebrae and the facial bones, which shape that do not fit readily into the three categories.
Explain the structural difference between compact bone and spongy bone. Compact bone, also known as a cortical bone, is the dense outer layer of the bone that forms the hard, solid part of the bone tissue. It is characterized by its smooth, homogeneous appearance, and it's responsible for providing strength, protection, and support to the body. Spongy bone, also known as cancellous or trabecular bone, has a porous, honeycomb-like structure that is found in the inner layer of the bone and at the end of the long bone. It provides balance to the dense and heavy compact bone by making bones lighter so that muscle can move them more easily. Bone ossification, growth, remodeling, and repair are dynamic processes that occur throughout a person's life. Here is an outline of this process. Bone ossification, also known as osteogenesis, is the process of bone formation. There are two main types of bone ossification: intramembranous ossification and endochondral ossification. Intramembranous ossification occurs in flat bone, example skull, and some irregular bones. Endochondral ossification, most common process for long bones, cartilage model is formed first. Bone growth occurs by deposition of new bone lamellae into existing bone or other connective tissue. Fusional growth, osteoblasts deposit new bone matrix on the surface of bone between the periosteum and the existing bone matrix. The bone increases in the width or diameter. Bone remodeling occurs in all bone, responsible for change in bone shape, the adjustment of bone to stress, bone repair, and calcium ion relegation in the body fluid. Throughout life, bone tissue is constantly being resorbed and replaced. Involve the coordinated action of osteoblast bone formation and osteoclast bone resorption.
Bone and calcium homeostasis. I'm going to explain the role of the bones in calcium homeostasis and describe how parathyroid hormones and calcitonin influence the bone's health and calcium homeostasis. Explain the role of the bones in calcium homeostasis. Bone plays a crucial role in calcium homeostasis as a reservoir for calcium, storing 99% of the body's calcium in hydroxyapatite crystal within the bone matrix. During period of low blood calcium levels, bone undergoes resorption, releasing store of calcium into the bloodstream. Bone remodeling involves bone resorption and formation, coordinated by the osteoclast and osteoblast. Bone homeostasis allows the body to adapt the changing calcium demands with increased calcium requirements, leading to elevated blood calcium levels. Hormones such as parathyroid hormones and calcitonin regulates the interaction between bone and calcium homeostasis. Calcium homeostasis is maintained by the three hormones. First is parathyroid hormones. It came from the thyroid glands. Next is vitamin D. It came from skin or diet. Third is calcitonin. It came from thyroid glands. Next, describe how parathyroid hormones and calcitonin influence bones health and calcium homeostasis. Parathyroid hormones released in response to low blood calcium levels, serving as a primary regulator to restore equilibrium. Parathyroid hormones stimulate the activity of osteoclast specialized cells response for bone resorption. This process releases stored calcium and phosphorus from the bone matrix into the bloodstream. Parathyroid hormones enhance the reabsorption of the calcium in the kidney, reducing its exertion in urine. Additionally, parathyroid hormones activate vitamin D in kidney, facilitating increased calcium absorption in the intestine. Through the combined effect of the bone, kidney, and the vitamin D activation, parathyroid, an increase in body calcium level. This response is crucial, meeting the body of immediately demands for calcium and maintain physiological function. Calcitonin, produced by the parafollicular cells of the thyroid glands. Calcitonin acts as a counterbalance to the parathyroid hormones, particularly in response to elevated blood calcium levels. Calcitonin inhibits the activity of osteoclast, thereby reducing bone's resorption. This result is decreased release of calcium from the bone matrix into the bloodstream, while the effect of calcitonin on the kidney are less pronounced on those parathyroid hormones. It may contribute to a mild reduction in renal reabsorption of calcium. By straining bones absorption, calcitonin helps lower blood calcium levels, preventing excessive accumulation and maintain the delicate balance of calcium in the body. General consideration of bones anatomy. I'm going to show you the list and define the major feature of typical bones. First is body. It is main portion. Head, enlarged, often rounded end. Next, neck, constricted area between the body, the head and the body. Condyle, smooth, rounded, articular surface. Fossette, small, flattened, articular surface. Chest, prominent ridge. Process, prominent projection. Tubercle or tuberosity, knob or enlargement. Trochanter, large tuberosity found only at proximal femur. Epicondyle, enlargement near or above a condyle.
So we have the axial skeleton, and I will name the bones of the skull and describe their main features as we seen from lateral, frontal, internal, and inferior views. So first, we have the frontal bone. We have the lateral view forms the forehead and the upper part of the eye sockets. Frontal view contains the frontal cynosus, and its superior part forms the forehead. And we have the internal view contributes to the anterior and cranial fossa and the floor of the skull. So we have the inferior view articulates with the ethmoid bone and contributes to the formation of the orbits. So parietal bones and right and left. So we have the lateral view from the top and side of the skull. Frontal view articulates with each other at the sagittal suture. Internal view contribute to the roof and sides of the skull's cranial activity. Inferior view articulate with the temporal and frontal bones.
Temporal bones right and left. Lateral view contains the external auditory meatus, zygomatic process, and mastoid process. So in frontal view, squamous part forms part of the skill's lateral aspects. Internal view houses the middle and the inner ear structures, including the mastoid ear cells. Inferior view forms part of the skull base, articulating with the occipital bone. Occipital bone, we have the lateral view contains the external occipital protuberance and the superior and inferior nuchal lines. Frontal view forms the posterior part of the skull. Internal view contributes to the formation of the posterior cranial fossa. Inferior view articulates with the first cervical vertebra. Sphenoid bone, lateral view contains the greater and lesser wings, forming part of the eye orbits. Frontal view forms part of the anterior skull base. Internal view houses the sella turcica, which holds the pituitary gland. Inferior view forms part of the floor of the skull and contribute the formation of the pterygoid processes. Ethmoid bone, lateral view contains the cribriform plate, which forms part of the roof of the nasal cavity. Frontal view contributes to the formation of the eye orbits. Internal view houses the ethmoidal air cells and the perpendicular plate, which forms part of the nasal septum. Inferior view articulates with the sphenoid and frontal bones. And lastly, we have the mandible. Lateral view forms the lower jaw and contains the body ramus and angle. Frontal view houses the alveoli for the lower teeth. Internal view contains the mandibular foramen for the passage of the inferior alveolar nerve. Inferior view articulates with the temporal mandibular joint and contains the mental foramen. We have the majority list of the nasal septum, which is the vomer bone and the perpendicular plate of ethmoid bone. And I will describe to you the location and functions of the paranasal cynosus. In location, we have frontal, maxillary, ethmoidal, and sphenoidal cynosus. And the functions is the cynosus decrease the width of the skull and out of resonating chambers during the voice production. We have also the list of the bones of the brain case. We have the sphenoid bone, parietal bone, frontal bone, ethmoid bone, temporal bone, and occipital bone. And now let's move on to I will describe to you the shape of the vertebral column and list of its division. The vertebral column or backbone is the central axis of the skeleton. 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 1 sacral bone, and 1 coccyx bone. The vertebral column is curved with 2 primary curvatures, thoracic and sacrooccygeal curves, and 2 secondary curvatures. Discuss to you the common features of the vertebrae and going to contrast vertebrae from each region of the vertebral column. Atlas. It holds up the head movement between the atlas and the occipital bone is responsible for motion of the head. And axis, considerable amount of rotation occurs at this vertebra. Cervical vertebra relatively delicate and have small bodies dislocations and fractures and more common in this area than other regions. Thoracic vertebrae, extra-articular facets on their lateral surface that articulate with ribs. Lumbar vertebrae, massive bodies and carry a large amount of weight. We have the list of the bones and cartilage of the rib cage, including the 3 types of ribs. So we have the 3 bones and cartilage of the ribs. True ribs, vertebrosternal ribs 1 to 7. B. False ribs, vertebrochondral ribs 8 to 10, and floating ribs 11 and 12. We have the 3 types of ribs, which is the sternum in the breastbone. We have the ribs and the costal cartilage. Perpendicular skeleton. Let's identify the bones that make up the pectoral girdle. Scapula, shoulder blade, a triangular shaped bone located on the posterior side of the rib cage. Function: provides attachment points for various muscles that control shoulder movements. Clavicle, collarbone. The clavicle is an S-shaped bone positioned horizontally at the base of the neck, connecting the sternum to the scapula. Functions: it acts as a strut, transmitting force from the upper limb to the axial skeleton. I'll name and describe to you the major bones of the upper limb. The arm, the region between the shoulder and the elbow, it contains humerus. The proximal end of the humerus has a smooth rounded head which attach the numbers to the scapula at the glenoid cavity. Forearm has 2 bones, the ulna on the medial side of the forearm and the radius on the internal side. Wrist, short region between the forearm and the hand. It composed of 8 carpal bones. Hands has 5 metacarpal bones are attached to the carpal bones and form the bony framework of the hand. Pelvic girdle. Sacrum, a triangular bone formed by the fusion of 5 sacral vertebrae at the base of the spine. Costal bone, hip bones join each other anteriorly. Ilium, the largest and uppermost bone of the pelvis bone. Ischium, the lowest and posterior part of the pelvic bone. Pubis, the anterior portion of the pelvic bone. Girdle is more stable than the pectoral girdle. The pelvic girdle is more stable than the pectoral girdle because the joints in the pelvic girdle are only slightly mobile to enhance its ability to bear weight and protect organs. We have the bone of Cossa, which is the ilium, ischium, and pubis. And let's distinguish the between male pelvis and female pelvis. In male pelvis, we have the larger and more massive. The bones are thicker and move prominent. In female pelvis, tends to be broader. Both the inlet and the outlet of the female pelvis are larger. Subpubic angle is greater. We're going to identify the bones of the lower line. We have femur, the single bone of the thigh, patella, the kneecap and articulates with the distal femur, tibia, major weight-bearing bone of the leg, fibula, the thin bone of the lateral leg, tarsal bone. There are 7 tarsal bones in the foot, forming the proximal part of the foot's skeleton. Metatarsal bones, these are 5 long bones situated between the tarsal bones and the phalanges. Phalanges, the foot has 14 phalanges with each 2 having 3 except for the big toe, which has 2.
A joint is casually considered movable, but it is not always the case. Many joints, limited movement, and others are completely or almost completely immovable. We use an extractional classification whereby joints are classified according to the type of connective tissue that binds the bones together, and there are the tissue filled or fluid filled joint capsules. Synarthrosis are non-movable joint, and ampiarthrosis slightly movable joint, or a diarthrosis freely movable joint. The 3 major structural classes of joints are fibrous, cartilaginous, and synovial. Let me explain first the fibrous. Fibrous joints consist of 2 bones that are unite by fibrous tissue and exhibit little or no movement. Joints in this group are further subdivided to the basis of structure as sutures, so syndesmosis or gumposis. Sutures are fibrous joints between the bones of the skull and a newborn baby. Some parts of sutures are quite wide and are called fontanelles. Of soft spots, they allow flexibility in the skull during the birth processes, as well as growth of the head after birth. So let's proceed to the syndesmoses. Syndesmoses are fibrous joints in which the bones are separated by some distance and held together by ligaments. So next, let's proceed to cartilaginous joints. So cartilaginous joints unite 2 bones by means of cartilage. Only slight movement can occur in this joint. So let's proceed to synovial, which is the last part. Synovial joints are freely movable joints that contain movable joints fluid in a cavity surrounding the ends of articulating bones. So several features of synovial joints are important to their function. So we have articular cartilage. The articular surfaces of bones within synovial joints are covered with a thin layer of articular cartilage, which provides a smooth surface where the bones meet. So let's proceed to the joint cavity. Types of synovial joints. So plane joints. Plane joints or gliding joints consist of 2 opposed flat surfaces that glide over each other. So example of these joints are the articular facets between vertebrae. So next, let's proceed to saddle joints. Saddle joints consist of 2 saddle-shaped articulating surfaces oriented at the right angles to each other. So movement these joints can occur into 2 planes: the joint between the metacarpal and the carpal bones, or trapezium. of the thumb is a saddle joint. So next, proceed to hinge joint. Hinge joints permit movement in one plane only. They consist of a convex cylinder of one bone applied to a corresponding concavity of the other bone. So example are the elbow and the knee joints. So let's proceed to minimize. The flat condylar surface of the knee joint is modified into a concave surface by shock absorbing fibrocartilage pads called menisci. So let's proceed to pivot joints. These pivot joints restrict movements to rotation around a single axis. Each pivot joint consists of a cylindrical bony process that rotates within a ring composed partly of bone and partly of ligament. So let's proceed to the ball and socket joint. So this joint consists of a ball or head at the end of the bone and a socket in an adjacent bone into which a portion of the ball fits. So these types of joint allows a wide range of movement in almost any direction. Example of these are the shoulder and hip joints. So let's proceed to the last one, which is the ellipsoid joints. The shape of the joints limits its range of movement nearly to that of a hinge motion, but in two planes. Example of ellipsoid joints are the two between the occipital condyles of the skull and the atlas of the vertebral column, and the joints between the metacarpal bones and phalanges. That will be all. Thank you. So, effect of aging in skeletal and joints. So, muscles may become rigid with age and may lose tone, even with regular exercise. Bones become more brittle and may break more easily. Overall height decrease mainly because the trunk and the spine shorten. Breakdown of the joints may lead to inflammation, pain, stiffness, and deformity.
Thank you.
So how does aging affect skeletal muscle? So as we age, there is an age-related loss in skeletal muscle and mass and strength. Bones become more brittle and may break more easily. So overall height decreases mainly because the trunk and the spine shorten. Breakdown of joints may lead to inflammation, pain, stiffness, and deformity. Joint can change affect almost all older people. So that will be all my topic. Thank you.